Hello, John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. It's the last day of our working day for 2024. Nevertheless, keratoconus is here. We're going to see together some very interesting cases. This is a 19-year-old gentleman that we saw today, and we'll see here his data. Uncorrected visual acuity, 20/30 on the right eye, under 20/40 in the left eye, pinholes to 20/20 with the automated refraction of 325 astigmatism in the left, 175 on the right. Patient says, I'm seeing perfectly. Nevertheless, we're in Greece. Keratoconus is a big issue. We're gonna go look at this young gentleman's images. This is a right eye. We can now appreciate that this is keratoconus. It's picked up by the algorithm of the Pentacam. We can see how the cornea thins abruptly, temporally on the right eye. There's truncation of the astigmatism, regularity of the astigmatism, and looking at the elevation maps, it doesn't look that significant. If we go and look at the other eye, far more. Steepest K here is about 48. This is the eye that flagged over 3 diopters of astigmatism on the autorefraction. Same phenomena, although temporally on the left eye. And of course, our next step here is to look at the epithelial maps, which do document on the left eye that the cornea thins abruptly, and there is compensation by the epithelium. He doesn't wear contact lenses and he sleeps face down, so he rubs his eye during his sleep. This is the right eye, the left eye and the right eye. Again, we're seeing the epithelial remodeling and how this affects the keratoconus. Thus, in our opinion, this is active keratoconus in both eyes. And we did recommend for this young gentleman to undergo cornea crossing in the left eye for sure, which is worse, and monitor closely at the 19 years that he is the right eye for it not to become worse. Of course, he came in with his father, and let's go and look at the father's data. So these are the Pentacam maps for the father of this young gentleman, and we're seeing that the father has a lot of regular astigmatism on this eye, and he is amblyopic in this eye, and the other eye looks almost normal. The only thing giving away the predisposition for keratoconus in the other eye is the fact that the cornea thickness is skewed temporally, and this is evident in the posterior elevation of the cornea, where it does not coincide with the angle kappa. His angle kappa on the x-axis is only 200 microns, and this does not coincide with the over millimeter change of cornea thickness distribution in this gentleman. So there is keratoconus predisposition on the left eye, which blossomed in his son. He's 65, his son is 19. What happens though with the right eye of this gentleman? And the right eye of this gentleman has an interesting clinical finding. We're seeing on his right eye something that we've described in the past. He has a distinct split in Descemet's membrane in the right eye, ranging from the 10 o'clock position, radiating to the 4 o'clock position, causing this very interesting Pentacam map that we saw here. And this Descemet split is without a doubt a forceps injury. When he was born with forceps pushed on the cornea. This direction is typically just in one eye. The cornea became stretched. They create these the split in Descemet's membrane, kind of resembling Hub stria that we see in congenital glaucoma, although there's no other changes here to depict that. And we can see further imaging on this gentleman with anterior segment OCT. We can see the area of the cornea here that is without Descemet's membrane and is scarred. We'll see more of these images. For instance, here we can see the place where Descemet's membrane has curled on itself, has created this little roll, and here it's normal distribution. The cornea is much thicker in this eye. Nevertheless, with a contact lens, his vision was able to reach the 20/25 level, so he's not actually amblyopic, and with a procedure in the future, and this is a better image of this rolled of Descemet's split with forceps delivery. With a topography guided procedure, he could probably recover significant visual acuity, as we saw that topographically his astigmatism is at the astounding 6.3 diopters with this very regular looking astigmatism, nothing really suspicious on the pedicam, but nevertheless with a evident on slit lamp decimate split and a distribution of the cornea the way we're seeing it here. Hope you found this interesting. This is John Kanellopoulos from Athens, signing out our last video for 2024. I wish you a very happy and healthy 2025.